Okay, thank you very much, Ainur, and as well Angela from Swiss Medtech for the support of the organization of this event. I would like to welcome everyone to our event update on the impact of the MRA, MDR, Ivdr on the Swiss economic operators. Today, I'm very glad to have with me Christophe Perritaz from the Federal Department of Economic Affairs and Daniel Delfosse from Swiss Medtech. And myself, of course. I would like to give you a short introduction about QUNIQUE, who we are and what we are doing. So we are based in Switzerland and in Germany. We are a consulting and training company, and we are supporting our industry with our experts in quality and regulatory by implementing the regulatory requirements into your organization. We are really a bridge, we are building a bridge between different stakeholders. So we are supporting suppliers, manufacturers, up to distributors and our representative, but as well hospitals. To my person, I have 15 years experience in the medical device area. I have a biomedical engineering master degree, and I'm as well a lead auditor, ISO 13485. Our service portfolios, as I mentioned, quality management, regulatory affairs, project management, coaching, leadership, and training. Before we start, I would like, of course, to give you the disclaimer. So the presentation was built on the information that is currently available and which we really prepared on the best knowledge that we have right now. Right now, we have the challenge with the Brexit, COVID-19, and the Mutual Recognition Agreement, so-called MRA, between the Switzerland and the EU. Today, we will focus on the Mutual Recognition Agreement and give you more information there. And I'm sure you will get now today more new information. Before we start, let me bring you all to the same level. So when we are talking about economic operators, what are these roles exactly? So we have the manufacturer, this is one economic operator. Then we have the offer representative, importer, distributor, and the person referred in our in MDR article 22.1, which is a role which is when you place them on a device on the market, a system or procedure pack, and the person mentioned in MDR article 22.3 is the natural or legal person who sterilizes systems or procedure packs. I want to show you this slide because it's really important to understand what will come. So we have explained already the different economic operators' roles, right? So we have on the one side the manufacturer and on the other side the importer, distributor, the offer representative. As well, we have the competent authorities, of course, and the notified bodies. What we have done is we have checked, okay, what does that mean if we, for example, look into the MDR very closely? And when you look very closely, then you will see that there are reporting obligations. There are as well steps where you have to check topics on the offer representative, for example, when you are on the importer part or from the distributor. And in total, if you look at that picture, it looks really like Big Brother or Big Sisters are watching you, dear manufacturer. So what I would like to mention here is please choose wisely your economic operators, where you will have anyway contracts in place and as well quality agreements. The traceability is a very important topic. So with the whole MDR, Ivdr, and as well the medical device legislation, what we have here is the whole traceability. So we have on the one side the sub-suppliers, suppliers, manufacturers, offer representatives, importers, and distributors. But on the other side, we have the customers and users and patients. So when the customer or user or patient is giving a feedback, complaint, or vigilance, this data is going back from that side to the manufacturer. So the distributor has immediately to report it back, the authorized representative as well, and the importer too. So the manufacturers, it's important to understand, if you're not a manufacturer, that the manufacturer has really strict timelines to report in case of vigilance cases this to their notified body or competent authorities. What will the manufacturer do is, of course, to analyze the problem and then as well check if that has an impact on their suppliers, and then the suppliers will check if that has an impact on their sub-suppliers. So that's why it's really important to understand that why we have the contracts in place and why all the others needs to cooperate so that everyone can fulfill their responsibilities and obligations. What we have done for you is checking the medical device, Swiss medical device legislation against the MDR and Ivdr. So please note that the translation that we have given here is our translation, since we didn't have any official translation of the Swiss medical legislation. So when we compare, what does that say? Any natural or legal person established in Switzerland who is instructed in writing by a manufacturer established abroad to perform certain tasks on his behalf arising from manufacturer's obligation under this regulation. And if you see here, then the difference is really that the authorized representative, the Swiss authorized representative, needs to be in place in Switzerland, and the European representative will be then established within the Union. If we have a close look into the obligations that the authorized representative have, is that there needs to be a written mandate which has really clear tasks written down. And this one is important between you, dear authorized representative, and the manufacturer. It's not between the distributor and authorized representative or importer and authorized representative. It is really between the authorized representative and the manufacturer. We have to make as well here note that the authorized representative needs to have an PRRC available, so-called person responsible for regulatory compliance. It can't be the same person. The authorized representative, they have to verify and as well keep the available copy of the technical documentation in place. We have later prepared some questions that we have received, where as well some questions are regarding how to keep the technical documentation. And then it's important to understand as well that the authorized representative has to keep the documentation at least 10 years. So you need to make sure that you have it in place 10 years. When we go, I will share anyway with you all the details and the presentation later on. But for me, it's important that you have a summary of the main obligations. So you see here as well, for example, that the authorized representative has to work closely with the competent authority. So that's why you have to really choose closely your authorized representative. Now we are in the topic importer. So when we check these two definitions, we will find out that the only difference here is that the importer needs to be established for the Swiss importer in Switzerland and for the European one in the Union. When we look then what are the obligations between the importer and as well distributor, there are slightly differences. But let's have a look into the importer. So what does the importer do? They have to verify that this device has CE mark and that there is a declaration of conformity available. They have to check as well and make sure that the storage and transport conditions are clearly defined and they are fulfilling it. They have to cooperate with the manufacturer, agents and authorities. They need as well to keep all the complaints as a complaint register, and their name needs to be on the product itself. We had last time question where exactly it needs to be placed, the label, the name of the importer. We will come back to that later as well. Now we go back to the distributor. So if we check the distributor and so the medical device legislation and the MDR and Ivdr, so it's the same. But the distributor here in that case is the distributor who is making available the product on the Swiss market, and in the European it's then the Union. The obligations of the distributor is to check the declaration of the conformity, then check as well if the importer is identified, so if it's visible on the label, and that if the manufacturer has assigned a UDI. I unfortunately still see many distributors who have not the storage and transport conditions under control. So make sure that you really understand what are the conditions from your manufacturer side, and please implement it. You need as well as distributor to cooperate with your competent authorities, of course, authorized representative and importers. And here as well, you need to have the register of your complaints, and in case as well from if you have an incident reporting, that you need to immediately forward it to the manufacturer and authorized representative. There's a very specific article which is 16 in the MDR and Ivdr. That one I would like as well to introduce to you. So in case that you would like to continue or you would like to introduce that service to your manufacturer, please make sure that you understand what will come with that service on top to you. So if you are translating, or if you would change the outer package of the device, the MDR Ivdr Article 16 is asking there for a certified quality management system. So in future, there will be a certificate from the notified body where it says then it's according to Article 16. Right now, we are not aware that any notified body have already given this certificate to any distributor or importer. This sheet is to let you or give you a hint that it's really important to understand the whole regulation. If it's MDR or Ivdr or the legislation, the Swiss one, you need to go through everything and not just one paragraph and say, yeah, that's it. It says importer or distributor. It's not. So we would really recommend you to go through everything and then make a search and see where else is the name distributor, importer, or authorized representative mentioned. Then you will see that there are several articles that refer to you too. Now I would like to show you the impact for Swiss and EU manufacturers in case of no MRA. In case that we have no MRA for Swiss manufacturers, and you would like to sell your products to Europe or Union, then you would need an EU importer and an EU authorized representative. And if you, dear manufacturer in Europe, and I know that we have several today here as well listening to us, you would need to have a Swiss importer and a Swiss authorized representative. What we need to as well focus on, it's not just the European Union. We have as well with the no MRA an impact outside. So for example, if we look into US, if there is a manufacturer and he would like to sell to Switzerland, this manufacturer would need as well a Swiss importer and a Swiss authorized representative. Another impact with no MRA will be that the Swiss authorities, they will not have access to the UDAMAT, and they will lose then their role as competent authority according to MDR and Ivdr. And right now it's not as well. I have published here the ACTA model frequently asked question. There will be no possibility for Swiss manufacturers to register, or Swiss as well offer representatives to register into Ivdr. Now I would like to hand over to Christophe. Christophe, are you there?
No worries, Angelina, I am here.
All right.
I hope you can hear me. I'm just trying to load the presentation. Will take a couple of seconds, and then it should all be all right. Well, my name is Christophe Perritaz, as Angelina said before. I'm working at SECO, the State Secretariat for Economic Affairs, and we are in charge of the update of the MRA together with the EU. We are working on this file together with the Federal Office of Public Health, which is in charge of the legislation in Switzerland, Swissmedic, which is implementing the legislation in Switzerland, and the Federal Department of Foreign Affairs, which is in charge of the relationship with the EU, the overall relationship with the EU. So thank you very much for the very good presentation from Angelina before. I think it's been very useful to understand the different roles and responsibilities of the economic operators under the MDR and then under the MRA. We need, indeed, as you know, we need an update of the MRA because there will be a new legislation in the EU as well as in Switzerland as of the 27th of May this year. In Switzerland, we have taken all necessary steps to have equivalent legislation with the EU. Angelina has shown that the obligations are pretty similar. The Parliament and the Federal Council have taken the necessary decisions, and therefore there will be a revised ordinance on medical devices, which has been decided last summer already. It will enter into force on the 26th of May, and it will be equivalent to the MDR, which will fully apply as of the end of May. And therefore, because we have an MRA, like all bilateral agreements between Switzerland and the EU from the so-called bilateral ones, they are static. So they need to be updated every time the legislation is being updated, either in the EU or in Switzerland. And medical devices is a bit special because we have had in 2017 a full revision of the legislation. You are very well aware of this because you have been preparing since then to be ready for the implementation. So now there is a little hiccup. Usually we update the MRA in order to provide for the necessary cooperation between the market surveillance authorities, between Switzerland and the EU, and also to agree on the release of some of the obligations between the Swiss and the EU economic operators in order to remove technical barriers to trade. Now there is a hiccup because due to the political situation between the EU and Switzerland, the EU declared 2 years ago that it will not update the existing bilateral agreements unless there is sufficient progress towards the signing of the so-called institutional agreement, which, if we have people from the EU, in the EU it is referred to as the institutional framework agreement, but it's the same thing we are referring to. So today I'm not going to discuss the progress on the institutional agreement because this is much above my pay grade, and this is not what we are here to discuss. This is being discussed at political level, almost political level at the moment. We have to work with scenarios because we don't know what the outcome of those discussions will be. So in order to help you and to try to explain where we are at the moment and for you to be able to take the necessary measures, maybe we will use three scenarios. The first one is if there is sufficient progress towards the signing of the institutional agreement, the impact on the MRA would be that we would have a full update of the MRA for medical devices. And then the good thing with the MRA is that when it works, you don't realize there is an MRA. You can trade seamlessly between Switzerland and the EU without even knowing that there is an agreement in between, because everything is working perfectly fine and smoothly. So this is our best case scenario. We have to see what will happen with the institutional agreement to see if a full update is possible. This is still an option in spite of everything which is at the moment. So we have to keep this as an option. I will, however, not discuss it further because this is our best case. If this happens, we're all happy and there is nothing to worry about. You will not need to have an authorized representative in the EU, nor will you have to relabel your medical devices when they are exported to the EU. That is our first scenario. The second scenario is if there isn't, at least by the end of May, sufficient progress towards the signing of the institutional agreement there, but there is somehow some sort of continuation of the bilateral agreements, in particular the MRA. And this is the scenario we'll focus in this presentation, because we need to differentiate the various situations. And then we should not forget there is also a worst case scenario. And the worst case scenario would be that there would be no progress in the institutional agreement, neither would there be any continuation of the bilateral agreements, and at least for medical devices, the MRA would cease to function at the end of May. This one is still also an option. We don't know what will happen. In this case, the industry will have to fulfill fully and completely all obligations that are set out in EU law for MDD products as well as for MDR products. I will not discuss this further either, because this is our worst case scenario, and I think it is very clear what you ought to do if this scenario were to materialize. But let's go to the next slide. I don't know whether you see it. Yes, I think it's coming with a slight delay. But you see only the lines, don't you?
Yes, we see only the lines, Christophe.
Sorry, so Teams is not up to speed. I'm sorry. I will skip to the next slide I had, and I will comment, because on the next slide I have the full slide. So there are two options. First of all, there is the MDR, so the medical devices regulation, and there are the old regime, the medical devices directives. As you are very well aware, this has all started in 2017 when the MDR has been published. And since 2017, there has been a voluntary application of the MDR. This regime was meant to last until May last year, but because of COVID, it's been extended until May this year. So this is where we will be, and from May this year, there will be of the MDR. So one thing that was already in force since 2017 is the designation and the notification of conformity assessment bodies. This is a long process under the MDR. This started in November 2017 in the EU. So this is the reason, because there was a partial application of the MDR. This is the reason why we did in Switzerland a first update of the ordinance on medical devices to include all those elements which have applied in the EU since November 2017. And we have also in December 2017 updated the MRA accordingly to reflect this partial application of the MDR, as well as the updated Swiss ordinance on medical devices. This has been working smoothly since December 2017, and indeed a Swiss conformity assessment body has been through the process of the designation together with the EU. Now, as I indicated before, we will need an update in May this year to reflect the mandatory and the full application of the MDR. This, we know, is linked to sufficient progress regarding the institutional agreement, and there is an uncertainty there. So without this update, what would that mean? What is working for MDR products under the MRA Act at the moment, and what is not working? So the joint designation of conformity assessment bodies would function. This has been working. Since 2017, and there would be a mutual recognition of conformity assessments issued by those bodies. I wish to note, however, that this element is there is a disagreement with the EU on the application of this agreement, but this is our view on this situation. What is very clear, and what we agree with the EU at this point, is that if there is no update of the MRA by this May, a Swiss manufacturer will need to appoint an authorized representative for MDR products in the EU. And the devices which are exported to the EU from Switzerland will need to be relabeled for the EU market, in particular to include the name and coordinates of the importer on the EU market. This has been explained. The rules and the obligation and responsibilities have been very well explained by Angelina earlier. So this is the situation with for MDR products. If we do not have an update by May 2021. And then the other situation is for MDD products. As you are probably aware, there has been, I'm going into the lines below. Sorry, it was on a previous on the third slide, but I'm taking this now a little bit in reverse. So as you're probably aware, the MDD certification devices can be certified according to the MDD, to the Medical Devices Directive, until 1st May 2020, and then it's been extended again, so until this May. So you can get new certificates under the MDD until this May. And then, according to Article 120, paragraph 2, 3, and 4 of the MDR, those certificates remain valid in the EU until May 2024. And so you can place products under certain conditions. You can place products based on those certificates on the EU market until May 2024, and then you can continue to make those products available in the EU until May 2025. This is set out in the MDR and is valid within the EU. This is the so-called grace period for legacy products. I'm sorry, this is a bit of jargon, and I'm not familiar with this jargon, but I'm sure Daniel can clarify the industry jargon later on. So where are we between Switzerland and the EU regarding MDD products? So MDD products and MDD certificates have been agreed and recognized for a very long time, according to the MRA. This has been all working very smoothly, and this is all being set out in the MRA. There is absolutely no problem until May 2021. This we are in full agreement with the EU on this aspect. Now the difficult part starts after May 2021. We are of the firm opinion that the MDD certificates, including Swiss certificates and including, of course, EU certificates for Switzerland, They are recognized until May 2021 mutually according to the MRA. This is undisputed. And then we are of the very firm opinion that certificates which have been accepted between the EU and Switzerland until May, they should remain valid in Switzerland as well as in the EU, according to the same conditions as set out in Article 120 of the MDR, so therefore until 2024 and 2025. With this, you should not have, and we should not need, for those so-called legacy products, you should not need an authorized representative in the EU, and EU manufacturers should not need an authorized representative in Switzerland for those legacy products. Nor would there be a requirement to relabel the devices with the name and contact address of the importer for those MGD, so-called legacy products. So I think this is the situation we are in at the moment. We are discussing, there are still uncertainties. We understand this is very difficult for the industry. These uncertainties has been there for quite some time now, and therefore they're in a need for clarity as soon as possible. You have already been under the burden of fully implementing the MDR, which is not an easy task. Maybe let me say a last word on this. We are fully aware that this is a very difficult situation, and we understand that our health system is under considerable stress already in order to fight against the pandemic. We have seen that cross-border supply chains are essential in the fight against the pandemic. This has been recently highlighted with the vaccines. But the same goes for medical devices, which are also essential for the health system to fight against the pandemic. And we know that Switzerland and Swiss manufacturers are providing quite a few medical devices which are necessary against the pandemic, like asthma patients, high pressure patients, or or patients suffering from kidney diseases. So it is, in our view, essential that we can preserve existing cross-border supply chain in this difficult time. It is, in our view, not necessary to add or to create additional stress onto a health system in those very difficult times. So we very much hope that we will end up at least with one of the first two scenarios, so either a full update or some sort of continuation of the MRA by the end of May. So thank you very much for listening. Maybe the last conclusion that I have to, and I'm sorry, it's certainly not satisfactory to you, but is that we have to prepare for the worst, but we have to hope for the best. And thank you very much for listening. I have put our email address with the specific page of the MRA. And with this, I hand over the microphone to Angelina and Ainur. Thank you very much.
Thank you very much, Christophe. Now it's Daniel's turn. Are you with us, Daniel?
Absolutely, of course, I'm here.
Right. Okay.
Now, well, I'll put it up here. Okay.
Yes, now we see it.
You can see it, that's good. So, let me see that I can see it so in front of me. Yes, my name is Daniel Delfosse. I'm the Director of Innovation and Regulation. Unfortunately, these days I'm not talking about innovation much. It's all about regulation. Well, we do hope that one of these days again we'll be talking more about the first part of my title, the innovation part. However, we have a couple of problems. We are at the position of becoming a third country for Europe, as Christophe has also mentioned, if there is no update to the MRA. Now, this creates a couple of problems for export as well as for import, because if you're part of a European and common market, you have no borders But if you are a third country, yes, you have to overcome the borders into Europe and also into Switzerland. Now, the big effects and negative effects of a third country status are really, it costs some money, but we can calculate this is about 2% of our turnover in Europe. So yes, that's feasible. It's not nice to spend more than 100 million francs that you would rather spend on, as I said, innovation or investments rather than on administration. But I think the big problem is really a loss of attractiveness of Switzerland as a location. And this is a big problem. If you have a startup, you ask yourself, why should I start in Switzerland if I have to set up a European company anyway? If I'm from the University of Basel, why not just go to Mulhouse or to Freiburg? On the other hand, for the importers, we have actually what we foresee a potential supply gap for the Swiss patients, because we think not all foreign manufacturers will be willing to install a Swiss rep. And I'm going to talk about both of those problems. First one, export of medical devices to Europe. Well, we have, as Christophe already mentioned, goal A, update the MREG's full inclusion of MDR and Ivdr before May. We are not so sure if this is really happening. We still hope, of course, and Christophe, we hand you all our hopes on a plate to you, make it possible. However, goal number 2 is that at least the EU Commission should recognize the current MRA in terms of the signature and give us the grace period for the Swiss MDD products according to the MDR without EAR labeling, and also give us the access to EUDAMED as is mentioned in the MRA. Now, there was the first position paper sent by Medtech Europe in February, talking about the non-discrimination of Switzerland for medical devices. And just yesterday, DG Santé and DG Trade sent a little communique saying that they want to mitigate the risk of possible disruptions of supply of medical devices on the EU market. And therefore, they are granting certificates already issued in Switzerland for existing medical devices, i.e. the legacy devices, MDD devices, the same transitional validity as is foreseen by the MDR. Now, this sounds very promising. It is a step of the EU towards Switzerland, and we do really appreciate it. On the other hand, the SECO has not received the text yet, and of course, we have to wait and see the text before we can interpret it, what it really means. So at the minute, we're not really sure how much this really helps us, but SECO will be on the ball here. Now let's switch to the other problem, the import. When we look at the map, we see there is a market attractivity of that blue part of Europe. That's the Euro common market, 450 million inhabitants. Then we have that little island to the left, which used to be a big part of world power, and now it's called UK, 66 million inhabitants. And then we have a little island inside that blue part, but that's Switzerland, not surrounded by the ocean, but surrounded by our neighboring, friendly neighboring countries. But unfortunately, we are only 8 million people in Switzerland. That means we are only 2% of the European market. Now, of course, if you have hurdles, if you build a regulatory system, the business decision of a foreign manufacturer must be, where do I place my products on the market? You're a Japanese, you look into Europe, what are you going to say? EU, yes, Switzerland, yes, UK, yes, it's all a decision. So our goal number 1 is we need a regulatory environment that is attractive for Swiss medtech companies. That means importers and distributors. We also want the Swiss patients to continue to have access to the medical devices as they had right now. So that means we have to have a regulatory environment that remains attractive for the foreign medtech companies as manufacturers who then need to supply Switzerland and obey to some of those rules. Now, we already know that some medical devices will be missing. We just do not know how many and which ones they are. but from our survey, we fear that almost 1/4 of all imported medical devices today may be missing in a couple of years' time. And that would mean about 12% of all medical devices in use today, as import is about half of the turnover, and the other half comes actually from Swiss manufacturers. So that means each eighth product is not available, or each eighth operation cannot be done. I mean, that's a huge impact for our Swiss health society, health system. Now, we do not know which ones they are. It depends on the willingness, for instance, to pay a higher remuneration. I mean, are you ready to pay a bit more because the foreign companies have a higher administrative burden to carry? All this will become clear in about 6 months' time, and we have actually started a list of missing products. You will get as information today through our homepage. If you have manufacturers who are no longer supplying you, please send us that on a list, and we'll compile it and send it to the Federal Council periodically. Now, there was always the question that the politicians ask me, well, you know, it's a great thing for you, Mr. Delfosse, for the Swiss Medtech industry. The Swiss Medtech can produce them all themselves. I have to say, well, we have, in the best case, 36,000 medical devices missing. We have 350 manufacturers, so each of them would have to take over 100 medical devices, develop them, produce them, get the clinical data, get the CE approval. This is an absolute impossibility. Question is, can they provide them elsewhere? Yes, we have 200 Swiss distributors, importers. Now, again, each of them has to take over 150 new medical devices, search for them, get a contract, distribute them, re-educate the customers. That's difficult and takes quite a bit of transition time. And just to give you an outlook of how many Swiss reps we really need. Today we have 5,000 foreign manufacturers delivering their medical devices to Switzerland. Yes, we need 5,000 Swiss reps if all of them continue to be suppliers. Not all of the distributors are ready to take on a mandate as a Swiss reps. So let's say we have 100, half of them, and maybe 20 consultant companies. That means each of them have to take on 40 mandates with 40 companies. So again, you can see that this is going to take quite a long time. We did actually look at the time that was needed to establish a Swiss AR, and in short, to have the mandate in place is about 10 months, but to also look for substitution products and re-education of the customer takes 1.5 years. So with this, we went to the authorities who are now rewriting or modifying the medical device ordinance that will come in place if there is no MRA on the 26th of May this year. And we have actually negotiated a transition period for the establishment of the Swiss AR until the end of this year for medical devices class 3, implantable 2B and active, until end of March next year for class 2A, and until the end of July for class 1 and the procedure packs. You also would have to register the Swiss AR within 3 months after placing the products on the market, and if you are already placing MDR products on the market, you must register until the 26th of November, within 6 months after the MDR becomes applicable. The same thing, 6 months applies for the registration of products, systems and procedure packs as soon as the database at Swissmedic is ready, which is not yet at this point in time. We also have some technical aspects in the medical device ordinance, such as the access to the technical file. So you either have a copy of the technical file at the Swiss AR, this basically is what Europe asks for the European rep, or you can also guarantee an access to the technical file by Swissmedic if they ask for it within 7 days. You have obligation to report continuous incidents, vigilance reports to Swissmedic and not to Eudamed, because it is not possible if there is no MRA. And this summary of safety and clinical performance, the SSCP, has to be published, validated first by the notified body, and then published by the manufacturer itself. So again, uploading by the notified body to Udemy is not feasible. Those are some of the changes that are happening, and this amendment of the ordinance will actually become, will be in power at the 26th of May this year. Now, this was quite a challenge for us, as also for the authorities, because they said, well, it's really difficult to weigh up the interest. Security of supply is only one thing we have to look at. Product safety, enforceability, equivalence to the Europe is also very important, but all this comes at a price. Now, if we have that political balancing of goods, that costs us something. We want to be equivalent to the European law and basically to the MDR, Ivdr. We also want to have that increased safety of the medical device that the MDR brings with it due to higher demands on clinical and performance data. So we have estimated this in our report, the SMTI report last September, as 8%. So each medical device will cost 8% more to manufacture because of the administrative burden brought on by the MDR. We are also now looking at being a third country. We still want enforceability in Switzerland. That means Swiss authority want to have a Swiss entity if there is a problem with Swiss patients. And Europe wants the same in Europe. So we see this is somewhere around 2% for the EAR, or 1 to 10%. It remains to be seen for the Swiss AR, for the establishment. And we also have the security of supply. If we do not have access to the medical devices as we have today, well, we need to substitute them. And usually if something becomes scarce, it is not lower the price. So we do see somewhere 10 to 20% increase for each medical device that we have today in Switzerland. Now my second last slide here, who pays for that? The government? Not really, they pay for some more workload of the authorities, yeah. Industry, if industry has to pay, that means they lose margin and some of the companies will be at risk. If the healthcare providers have to pay, again, they lose margin, so they put themselves at risk, or they have a higher hospital deficit, which the taxpayer will at the end have to pay. If we say the patient has to pay because increased safety, increased cost, then he will have to pay a higher insurance premium. And if we say a medical device increases by 10%, medical devices are about 15% of the health care expense, that would mean each one of us would have to pay 1.5% more for his own insurance premium. Now, all this we really would like to have as little disruption as possible, which is why we really support our industry, not only by talking to the authorities, but also by handing out information for the Swiss manufacturers or the Swiss importers and distributors. As you can see, guidelines, webinars as we do today, Q&A sessions, and please check our homepage. Thank you very much.
Daniel, could you please share again your slide? There is one important question. I think I have to take it now. So let's go back to your slide with the transition period.
Okay, yeah.
If it's possible.
It is possible, yes, of course, yeah. Let me just get on it right away.
Because someone asked about the timeline. So until when the authorized representative and labeling need to be in place for the different classes? Because you have shown in one slide very nicely when it needs to be done, and if it's really already the case, or is it still under the discussion?
This is actually the medical device ordinance as it is written and handed over to the Federal Council. If the Federal Council does not change anything, and of course if the MDR is not updated before 26th of May, this is how the timelines will come out.
Okay, good. then I will take over and share my slides. So we have received, or let's say we have asked many of you to send your questions to us. I will try to share, let's see. So I hope you see my slides.
Me do, yeah.
Okay, perfectly. So we have asked you to send us your questions. I saw already that we have as well many questions in the chat. So we will try to address as much as possible today. So let's start, don't lose time. So the first question was, does an authorized representative in Switzerland have to have on site a copy of the entire technical documentation of the medical device from the manufacturer in the EU, or a contractual provision stating that he or the authorities can have prompt access inside into the documents if necessary is enough? As Daniel has shown already, so it needs to be on site, or you need to grant the access. However, I would like to mention here, you as an authorized representative have the obligation to verify these technical documentation. So you need to get access and you need to go through it. The next question is for you, Daniel. Can medical devices that were put into stock before May 26, 2021 still be sold?
Yes, that's very easy. It can be whatever is actually on stock in Switzerland. That means has had a handover to the Swiss entity, can be sold before the transition period runs out. So it's not only before May 26 for Class 3 devices. Whatever you have in Switzerland sold to your Swiss entity before the end of the year can still be sold later on without labeling.
Daniel, next questions are for you. Will Swissmedic come up with a last-ditch effort to save the Swiss healthcare a lot of needles and avoidable costs? For example, by copying the UK MHRA solution for 1 year extension of the EUC marking under the current legal regime for Switzerland?
No. Very short answer. No, it's impossible. That doesn't work. No. No.
If the current guidance will stay valid, then what are the labeling requirements for an importer or for a representative into Switzerland, if any? Would just a sticker with the address on the outer shipping package work?
Yes, absolutely. A sticker on the outer shipping package will do. However, it depends what the outer shipping package is, because that the label with the Swiss rep at least has to come has to go to the healthcare provider or to the final user. So we have to check where that outer is defined. But yes, the sticker will be sufficient.
Good. With whom does the importer or Swiss authorized representative register?
They have to register with Swissmedic. However, the database doesn't exist yet, so they can't do it yet. So you can't register at Udmed, you can't register at Swissmedic, you just have to be patient and wait.
And prepared. Finally, who is the contact person for this matter at Swissmedic?
That is maybe not clear, but there's an email, and I would have to look it up again, but I think it's medical devices at Swissmedic.
Can we share that later? So if you send it, send it please to us, and then we will share it with the attendees. Christophe, what needs to be considered if the MRA does not come? How can we still be on MDR ready? Is it still relevant at all?
Well, yes, I have tried to explain this in the slides. For MDD products, we are of the firm view that this should continue in accordance with the grace period that is valid in the EU. And for MDR product, I think, Angelina, you have explained it very well. So Swiss manufacturers will need an authorized representative in the EU, and devices will need to be relabeled, in particular to include the contact details and the address of the importer.
Mm-hmm. Good. The next question.
And in some way or another, I don't know in what direction the question is raised. Obviously, the same will go for EU manufacturers and exporters to Switzerland.
Next question is, what is being done on the political side to ensure that the MRA can still be concluded? It's for you, Christophe, too.
Yeah, well, I think the first thing that has been done is when the Swiss people last year confirmed the bilateral way in the autumn by rejecting the initiative on delimitation. And since then, well, as you know, there has been three elements on the institutional agreement which needs to be clarified. The discussions have started this year, and at almost at a very high level, there has been discussion on this. Of course, you have also noted, and in Switzerland there is a strong disagreement on those issues, so this still needs to be sorted out. Regarding the MRA, we have intervened at all possible levels already last year to maintain essential cross-border supplies of medical devices and to be able to achieve a full update of the MRA. Those discussions are still ongoing together with the European Commission. We know that the time is getting extremely short, and we continue to work very hard, and we hope that we have the best possible results as soon as possible.
All right. I know that we have already 2 minutes delay, but if everyone else wants to stay, and if you, Daniel, and Christophe have still maybe 10 minutes, we can answer the questions. Is it fine for you, Daniel and Christophe?
Yeah, that's okay. Yeah.
All right, then let's take the next one. Many European manufacturers have MDD EC certificates with extended validity until around May 2024. And these certificates, as well as the products, will stay marketable in the EU until May 2024. Will we, as an importer in Switzerland, be able to continue selling products with valid MDD certificates in Switzerland after May 2021? These products have been on the market in Switzerland for many years.
Well, there is a transition period in Switzerland, but it's not the grace period of 3 years until May 2024. So the transition periods that I showed are applicable if you want to continue to sell your products independent of MDD or MDR certificates, but you need a Swiss representative afterwards.
Are the representative Swiss rep, importer, etc. for the IVD products according Ivdr the same as for the classical medical device according MDR? Yes, we have compared them, so it's the same. Please, as I said, we will send you the slides, then you can compare as well by yourself. What does a Swiss authorized representative or importer have to check for Class 1 products, since there is only the declaration of conformity and no EC certificate, for example? An authorized representative have as well to check for Class 1 devices the technical documentation. So it's not just the declaration of conformity. Don't please mix up the role of authorized representative with importer or distributor. Christophe, this question is for you. Accept the duties for document control, labeling, etc. of an importer, Swiss authorized representative. What exactly needs to be reported to Swissmedic?
Well, I'm sorry, but I'll hand over. It would be useful if Daniel would add this up. But basically, everything which would need to be registered in EUDAMED, and everything is registered in Article 33, I think, of the MDR. So everything would need to be provided to Swissmedic. But maybe Daniel would be more specific on this.
No, it's perfect what you say. It's the same duties to EUDAMED, but in Switzerland it is actually to Swissmedic, to the Swiss authority.
Mm-hmm. Additionally, maybe I can add as well. So in case that you are noticing that you have a falsified device, this needs to be reported as well. Yeah. Are the templates for Swiss authorized representative mandate contracts from Swissmedic, BAG, or someone else?
No, this is something that we gave into actually. We wanted to have a mandate contract, but there is no help to be expected from the authorities. That's not their job. That's our job. And so we did this together with a consultant and also some legal aid.
Mm-hmm. Are there guidelines for contracts, etc., with PRRC, the person responsible for regulatory compliance? What kind of insurance is needed because of the legal responsibility? Do PRRC have to be submitted at Swissmedic? So there is one document that I added here. It's from the European Commission, which is a guidance document, and I would really recommend you to take that. And there are many, many questions already addressed. Regarding the insurance, I would really recommend you to talk to your company and see what kind of insurances are currently already in place and how you as a PRC can be secured there. And if the PRC have to be submitted or registered to Swissmedic, I would like to give it to Dani and Christophe. Currently, it's not the case.
No.
Okay. But it's not that we can say that it will not be the case.
Correct, yeah. I have no news on this role. Yeah.
What other roles are PRC allowed to fulfill in a company? Well, if you have a small company, of course you can just say that role is PRC and that role can't do another role. So what we really recommend, and you have to do it as well, is the contract where you as well sign off the obligation, the task that you are fulfilling within the organization. And plus, if you are doing other roles like marketing or beside these defined roles that PRC is described, it's fine as well. But you need to have it in written. Maybe this question, and then we have unfortunately already 10 past one. Daniel, from 27 May, do Class 1 devices placed on the Swiss market by a Swiss manufacturer also need to be conformity assessed according to the MDR, or will there be different implementation times?
I don't think I really understand that question, but it's all the same. The Swiss Medical Device Ordinance and the MDR go hand in hand, they're equivalent, so there is no different times. The only different implementation times are for a Swiss rep, but not for any conformity assessment. That is all the same as MDR. Mm-hmm.
And if you are really directly now, how likely do you think it is that the MRA agreement will be updated in time? I mean, we have only a few weeks.
Yes, we have said from 2 years on till now consistently, we still hope that it happens. However, you cannot build a business on hope, so you have to prepare if it's not coming, and we continue that argument, prepare that it's not here. Of course, we do have big hope in SECO and Christophe, but I do not think it's an easy task.
Mm-hmm. Could you please give a hint or link where the European representative should be best be located in order to avoid or minimize registration costs? I'm not sure if that person means EU authorized representative or Swiss authorized representative.
I think it's a EU representative, other countries which are cheaper than others. However, I think the most important thing is not the registration cost, it's the cost of exchange of information. So go to a place where they speak your language. That's more important than if you pay a few euros more or less. Mm-hmm. You need to trust each other.
Yes, and please make sure that you have a very, very professional authorized representative. So if you see that the contract was signed off and no verification task, nothing was done by the authorized representative, it shows only that it is everything on paper, but not really, checked and verified. So be careful there as well who you are choosing. Do you know if the EU will introduce import controls on whether medical devices have an EU authorized representative and registration? Will the borders check it more, and will they have work instructions so that to look closely on it?
That's a big question. We also sent to Medtech Europe. The answer was, of course, not clear. They do not hope that there are special import controls on either side of the border. At the end of the day, it's the authorities who have to look at it, and if there is something wrong, we do have the representatives who are responsible that whatever they have is in fact according to the laws that are valid in that member state or in Switzerland.
Mm-hmm. As you can see, we have, yeah, sorry.
But maybe if we say we have to finish, you have a couple of questions
yes.
in the chat.
I see, yes. So that's why I would propose that we really come back to you. The chat's questions, I will take them, and let me quickly change my view and see how many questions do we have already. Is there any question, Christophe or Danny, that you would like already to address?
Yes, I would like to address the one in bold. You know, when is it definitive that the transition periods are as I showed? Well, there is very little chance of them to be changed. However, they will only be accessible probably very close to the 26th of May. So if you want to be 100% sure, you wait, because this has to be, the medical device ordinance has to be freed up and put into place by the Federal Council. So they could theoretically put changes in there. I do not think that they will. And on the other hand, if SECO succeeds with an MRA signature, then of course everything's void. So again, I just can stress, prepare now, prepare it, do not execute before the 26th of May, because we have to wait and see if we cannot find a last-minute political solution.
Exactly. Christophe, could you try again to open your camera?
Hear me this time? Well, thank you very much to Angelina and the whole team of QUNIQUE and to Swiss Medtech. It is a joint event for the invitation. I hope it was useful, and discussion was very lively and very interesting. And we really understand your concerns. We know that the time is extremely short. We are working hard, and we hope for the best.
Danny?
Thank you, everyone. Just please check our homepage once in a while. We are actually putting when we have news, we put it on the homepage. We're just doing at the minute as I speak, somebody else is actually putting news on the homepage. So we try to keep you up to date as quickly as possible. Thank you very much.
Thank you. So our Easter present is coming today with the whole package of the presentation to all of you. Happy Easter, and and enjoy. Take care and see you all soon again. Bye-bye.
Thank you.
Bye.
Thank you.